So Care Jordan started helping Syrian refugees in early 2012. Initially, Syrian refugees were approaching our Iraqi refugee centre in East Amman. We were able to support over 4,000 families for winterization support from that centre, and have throughout 2013 supported over 110,000 Syrian beneficiaries from our Amman centre. In the summer of this year, we were then able to open 3 additional centres, one in Zaka and one in Abid and one in Mafraq. Those centres are particularly important given the concentration of Syrians in those northern cities. Mafraq, for example, the population has doubled, and so there is extreme need both for the Syrian community and for the Jordanian host community. So that really one of the keystones of what we're able to do for Syrian refugees is our emergency cash fund. And the emergency cash fund allows Syrians to mitigate financial shocks, but it also helps them to maintain their basic needs. And for Syrians living in the urban host communities, that's really rent for accommodation, also support for medical services and access to healthcare, sometimes support for food, and of course support for families who are trying to get their kids into education. In addition to that, we are able to provide essential information and referrals for Syrian families to be able to access other services, be that medical or educational or other essential needs that they have. All of our work is really built on our Syrian and Jordanian volunteers, and the volunteers are really at the front line. They are the first people that the Syrians see when they come into our centres, and it's those volunteers who help us to process over 800 Syrians every day.
I am a Syrian refugee. I'm here since 8 months in Jordan, and I'm very happy and lucky working as volunteers with Care. We can register up to 500 cases every day, and I can meet around 50 family every day, and I can speak to them and assess their condition. I'm very happy helping the Syrian refugees, but sometimes there is too much difficult to listen to their stories or their sufferings. And there is one case, this case made me feel very weak and sad when I meet the young mothers. And most of these mothers, they are here alone in Jordan without their husbands. The husband is still in Syria or dead or missing or arrested. When I ask her about some question from my phone, like how does she feel, how is her health, how is the child health, and she answered me sometimes that she is healthy and they are okay, but her face say the opposite. There is something in her face that cannot describe the suffering inside, and I cannot translate and describe this sadness to my papers, to my phone. This is what really makes me very weak, and I cannot handle these cases sometimes, and sometimes I get sick. Right? That's why Care helped me and helped the other volunteers by having counseling, and the counseling session we can talk about experience and about the impact this work has on us.